Hello, my name is Michelle Lori, and this is my case conceptualization project for counseling theories, and I will be using the theoretical orientation of existential therapy. So, the case study that I chose for this project is that of Carlos. I'm going to pop the case study up here just as a refresher, but to give some of the important details, Carlos is a 26-year-old Latino male. He is a first-generation immigrant from Mexico. He was raised by deeply religious parents who identify as Catholic. And there seems to be a little bit of questioning going on as to Carlos's sexuality. So I'm just gonna, for the purpose of this presentation, say that he is queer/questioning. So after looking over this case study, I would say that I think the presenting issues would be Carlos's anxiety and shame regarding his sexual orientation. He expressed that he had some feelings of sadness and loneliness, which seemed to stem around his lack of connectedness with both the queer community and his perceived inability to be his true self in front of others, namely his parents and his siblings. And then, of course, the fear of judgment from his parents and siblings, and the fear that their relationship will deteriorate if they do not approve of him being queer. Some protective factors that Carlos has are his supportive friends, the ones he has come out to who accept him, as well as his stable and enjoyable work environment. And then some risk factors. He's obviously in multiple minority categories, being Latino, being queer, or questioning. And then his parents being deeply religious, I think is just a risk factor based on his fear of coming out to them because of that. And in the case study, it kind of said that, his relationship with his parents was important to him, but it didn't really specify whether he was close with his parents or not. There was some mention of him feeling like he had already disappointed them because of his work. So there seems to be a little bit of an ambiguous relationship going on between them, which I think could be categorized as a risk factor. So we are going to look at how you might apply existential therapy to this case of Carlos. But first, let's do a little overview of existential therapy in general. So some of the key points of existential therapy, some of the main premises are that, first of all, people are free to make their own choices. And with that, they have to accept responsibility for the outcomes or the consequences of those decisions. Also, people assign their own meaning to life. They find their own meaning, create their own meaning. They determine what's important to them and what makes their life worth living to them. According to existentialism, a healthy development occurs when one lives an authentic life, so that means that they are able to be aware of and acknowledge the fears or anxieties or just the feelings in general that they have, and they're able to authentically work through them. And then maladaptive behaviors occur when a person fails to be aware of or fails to address those feelings. So getting into some of the multicultural or social justice implications of existential therapy, I would say that one of the pros is that existential therapy really dives into a lot of aspects of humanity and the human condition, including the individual, their social relationships, the client's culture, their spirituality, just a lot of aspects of the whole human being. So you want to consider, when you're using this theoretical approach, how does a person's cultural and spiritual background influence their behavior and their place in the world and their perception of who they are and what they contribute to the world in relation to all the things that make them who they are? And then you also want to ask if the client's life choices are affected or influenced by those aspects of their background or their being, I suppose. And then the cons would be that existentialism really emphasizes the individual, which I think can be a good thing, but there are some cultures or spiritual orientations that don't really subscribe to that idea and are more group-oriented. And then another con, I think, would be that existentialism can undermine or even ignore societal or cultural factors or environmental factors that contribute to the client's issues. So in this case of Carlos, he's queer or questioning. Existentialism does not really take into account that a lot of his feelings of shame are produced by the society that he is a part of and the environment that he lives in. Instead, it's more focused on what are you perceiving. Another aspect to consider in terms of multiculturalism. So when it comes to existential therapy or existentialism in general, we have these things called the existential givens, which are basically, just feelings or experiences that everybody who is a human being experiences, and those things are death, freedom, existential isolation, and meaninglessness. So these givens are experienced universally. Every human being can and probably does experience these things, but we have to take into account that everyone has their own unique and individual experience with these, and we all think about these things differently, we react to these things differently, and a lot of times the way we think about them and react to them is influenced by aspects of our background, such as culture, spirituality, upbringing, things like that. So the quote I have on the right here is a quote from a 2011 article. It says, "The existential givens, including the emotional nature of human beings, are universal in that they are something that all people experience. However, all the givens require a personal and cultural specific response, particularly when characterizing what is healthy versus unhealthy." So the point of this is to say that, we don't want to over or under pathologize the way that somebody is experiencing life, because we all have different experiences of life, and they are heavily influenced by our cultural differerences, spiritual differences, whatever it may be. In this specific case with Carlos, you obviously have to take into account that he's a male, he's Latino, he's a young adult. All of these things are going to impact how he perceives the world and the meaning that he assigns to his life experiences. So being able to be mindful of that as a therapist, as his therapist, is very important. One final thing to consider when it comes to the multicultural implications of existential therapy is this idea of freedom of choice. And freedom of choice is central to the ideas of existentialism. So obviously we are all free to make our own decisions, but those decisions that we have are created by our situation, our circumstances, and those are things that we do not get to choose. So I think that's important to keep in mind when you're working with people, specifically in minority groups, whether it's socioeconomic status or ethnicity or sexual orientation. Things like that you don't choose any of those things. You are born into that situation, and you might have a choice in how you react to it, but you do not get to choose, what you're born into. So I think it's really important to keep that in mind. So moving into the goals of counseling, in terms of existential therapy in general, some of the goals are going to be to encourage and aid the client in becoming more self-aware. Again, this aspect of self-awareness is huge in terms of existential therapy, helping the client address and confront the issues that they are facing and, be authentic in that way. Another goal is to help individuals, again, lead authentic lives and, find their own meaning out of life. Helping the client recognize the freedom of choice and then taking responsibility for the outcomes of those choices. And then helping the client find meaning in the present moment, and to kind of, it's kind of that aspect of mindfulness, and I will get into that a little bit later. But that is the general overview of the goals of existential therapy. So then, in terms of Carlos and his specific treatment goals, I think I would say, just from my perspective, that a goal would be to increase his self-awareness and understanding of, his own background and how those things influence how he's feeling now and influence his problems in the current day. Also kind of help him, figure out how he interacts with his background and help him find a concept of his own identity and what aspects of that background still play into who he wants to be. And that kind of plays into the next goal, which is to help Carlos identify what is meaningful to him and what would constitute a well-lived life for him specifically. And then helping him make choices and changes that align with his values and his idea of a meaningful life, which would include reducing feelings of anxiety, loneliness, and fear. And then I think another big goal would be to increase his social supports and his connectedness, not only to the queer community, I think that's an important one, but also just to humanity in general and to his parents, to his siblings, to the people that really should be part of his support system. So now let's get into how we would do this, the therapeutic procedure. So the first phase of existential therapy is the therapist is going to work with the client, obviously in this case it's Carlos, to help Carlos identify and clarify his beliefs about the world and his own being, where he fits into the world, how he views himself, how he views his background. So basically what you want to do with him is just hammer down what are his morals, what are his values, what are his core beliefs, and how does he see himself interacting with the rest of the world. I included this quote here on the right from a 2020 article that looked into existential therapy being used on young adults and adolescents. And I think existential therapy has the potential to be very effective in that age group, just because young adults typically, I don't want to say typically, but I feel like a lot of times feel, kind of lost, and they're still learning who they are and trying to form their own identities. And that's kind of what existential therapy is all about. And as we know, Carlos is 26, so he's still in that young adult category, and I feel like that those ideas really apply to him. I also included this quote because I think it really emphasizes the importance of the client-therapist relationship when it comes to existential therapy. And it talks about the importance of probing and asking the right questions and, providing an environment where a client feels comfortable enough to talk about those things. In existential therapy, I think one of the most important things is to, again, create that environment where the client feels comfortable opening up about their experiences and the meaning that they assign to those experiences. Giving them an environment where they can speak freely about all of that and not feel judged and, feel like they are learning more about themselves because they have the space to do that. So after you establish that, you would move into phase 2 of the therapeutic process, which is going to be really the meat of existential therapy. And that's where the therapist is going to work with Carlos. They're going to work together to help identify the source of Carlos's beliefs and values and morals and all of those things that he identified in the first phase. I think this is a good time to introduce Carlos to the idea of mindfulness, which is typically a more of a CBT, DBT kind of thing. The interesting thing about existential therapy is that there really are no set techniques or interventions. The main focus of the therapist is to employ techniques that really focus on the individual and that are relevant to the individual. And I do think that mindfulness really does go hand in hand with existential therapy. I have this quote on the right here that was from an article talking about the connectedness of the two things. They both really focus on reflecting on how you experience your life and what it means to you to experience life at all. So in this phase, I think it would be beneficial to psychoeducate Carlos about mindfulness, share some mindfulness practices with him, engage him in mindfulness activities, and just encourage him to, really be aware of who he is and how he is interacting with himself as well as the rest of the world. And then this is also the phase where you're going to get into helping Carlos identify what is meaningful to him, what to him is a life worth living, a life worthwhile, as well as his aspirations for his own identity. I think it's really important to focus on identity when you're doing existential therapy, because it's all about who you are and how you interact with the world and how you make meaning out of your situations. So after you help him identify those things, who he wants to be and how he wants to make his life meaningful to him, you can brainstorm ways that he can achieve those goals, that he can achieve that life, and obviously these are going to be probably baby steps, but just maybe like sitting down with him and brainstorming, what do you want your life to look like? That question of, if you woke up tomorrow and everything was perfect and how you wanted it to be, what would it look like? Who would you be? Things like that. I think this would also be an appropriate place to include a best possible self visualization exercise. So asking him, if you were your best self, if you reached your fullest potential, which, the idea of reaching your fullest potential is a big part of existentialism. What would that look like? And then, of course, you also want to open up this conversation about how, Carlos does have the freedom of choice, and engage him in a conversation where you are able to ascertain whether he, understands that or not, if he is able to accept that he has the freedom of choice, and if he is able to accept responsibility for the consequences of those choices. And you want to ultimately, I think, bring it back to this idea of freedom of choice is very powerful. You do not have, the choice of your circumstances or your situation or even your environment sometimes, but you do have the choice of how you react to it and what you do within that environment. Another part of this phase that I think is really important to focus on is this aspect of Carlos's sexual identity and his sexual orientation. He's obviously, having shameful feelings about it and confusing feelings about it, but this would be a good time to engage him in a mindful reflection that allows him to really explore his identity. And I include this quote on the right here because I think when it comes to sexual orientation and sexual identity, a lot of that stems from and actually requires us to be self-aware, and that is such a big aspect again of existential therapy, is encouraging the client to be self-aware and to be mindful of how they are existing in the world. For that reason, I think existential therapy actually goes pretty well when it comes to LGBTQ plus clients who are, in that phase of, they're just starting to gain awareness of who they think they are, they're questioning it, and they're trying to move towards accepting themselves. Having that awareness, I think, is really important in moving towards acceptance. And then you're going to move into phase 3, which is where you as a therapist would help Carlos take action to create this life that is meaningful to him. So a good thing to do here, I think, would be to sit down with Carlos and create sort of an outline or a plan that kind of details these changes that he wants to make, and kind of details, again, this like best possible self visualization exercise. I also think this would be the perfect time to employ the use of case management or peer services, because these are services that could help provide Carlos with those real world supports. You know, those people could go into the community with him and help him, you know, make those changes and actually act on these decisions that he wants to make. So, you know, a case manager or a peer could take him to a queer community event, and he could meet people and, you know, kind of become more connected with the queer community. And then another technique specifically in this phase that I think is really important is just providing Carlos with a understanding, empathetic, supportive environment that promotes change and promotes decision making. And I mean, everybody knows that when you're making decisions or trying to make changes, things don't always go as planned. So providing Carlos with an environment that acknowledges that you are allowed to fail, quote, fail, and that, you know, failures can be viewed as very normal and an opportunity to try again with a more informed approach. So that is Carlos and his existential therapy journey. But moving on here to my personal thoughts on existential therapy. So I actually do really enjoy existential therapy for many reasons. First of all, I think the emphasis on choice and responsibility / accountability is really great. Again, like I said, I think it's very empowering. You know, I think the power of choice is very important, and I think for that reason, existential therapy really aligns with my own values and opinions. There's also the emphasis on the factors that contribute to a person's worldview and like how they view themselves in conjunction with the rest of the world, and I think that's important. I also really enjoy the emphasis on acknowledging and ultimately being able to resolve our conflicts and our feelings and the things that we experience. And then I really also enjoy the emphasis on the client-therapist relationship, you know, having that very open, comfortable environment where the client can really explore who they are without feeling judgment. So in a lot of ways, I do think existential therapy does align with my values, and I could see it as something that I would, you know, take bits and pieces of into my own theoretical orientation. And then, of course, the con of existential therapy, the one thing that I don't necessarily love about it is that it can have a tendency to neglect the bigger picture. Again, going back to the idea of people who are in minority groups, you know, people who are discriminated against, it doesn't really take into account that, you know, we have a choice, but we don't have control of everything. So there are some things out of our control that affect our well-being, and existentialism doesn't really account for that. But other than that, again, like I said, I do really enjoy this theoretical orientation. And of course, these are my references if you would like to check them out. Thank you guys for watching / listening, and have a good day, night, whatever it is. Okay, goodbye.